My staff and I have spent countless hours, including right now, reviewing the American Health Care Act, the size, the scope, direct impact on Alaska, to see if it supports the goals of reforming our failing healthcare system in a manner demanded by the Alaskan people. Importantly, this has included in-depth discussions and conversations with numerous stakeholders, including the state of Alaska, Alaskan families, patients, and healthcare professionals. My goal remains the same: repeal Obamacare. The ultimate goal remains the same: to find a path towards a transition away from Obamacare and provide an individual with patient-centered reforms, added choice and flexibility, and relief from a one-size-fits-all federal mandate. Healthcare is broken as it is today. We've seen the numbers: skyrocketing premiums, soaring deductibles, and loss of all but one insurer in the state of Alaska. Ultimately, I support efforts to repeal and replace the Affordable Care Act. I also recognize it's very difficult to put the toothpaste back in the tube, as I said for years. And by the way, this is a three-tier process. These efforts can't be viewed in a vacuum. It's a multiple-tiered process. One might begin under the budget reconciliation process, the only way to bypass the Senate filibuster. The next administrative relief from HHS secretary. There's some 1,400 instances through regulations and the ACA that gives the HHS secretary wide scope to authority to make decisions that impact healthcare. Lastly, this process is aided with the passage of additional legislation, including the ability to purchase insurance across state lines, enact certain types of tort reform, associated health plans, allowing, for instance, to use an example of fishermen or any other group to band together to get cheaper insurance. What I support is transitioning away from Obamacare. This bill contains a number of the policy provisions I wanted to see preserved, including protections for pre-existing conditions, allowing dependents under 26 to remain on their parents' plans to no limit on lifetime caps. The bill is a major step toward lifting an invasive government mandate under individuals, one that's forced Americans to buy a product that's unattainable and unaffordable for their families. Repealing Obamacare's taxes in order to provide massive tax relief for hardworking people, that's crucially important. It eliminates burdensome taxes some people don't even understand, including myself. Strengthening health care saving programs by nearly doubling the amount you can contribute, giving you more control over your health care dollars. Of course, the process remains fluid. This process remains extremely fluid, and changes will be made. Speaker Ryan has said so much, and I'm working with him to improve this legislation under the confines of the budget process and beyond. The House Rules Committee is set to release some changes, including some relief for older patients. I'm working to fix concerns, equitable treatment. As I said before, I remain committed to improving this legislation in the areas where it falls short. One area which many Alaskans have commented on is the various serious disparities we see for our state. For 7 years, I said healthcare cannot be one-size-fits-all approach. Yet this is what we're seeing in Washington, D.C. today. If this is the legislation process we're going to pursue, it must be not disproportionately impact Alaska. No state in the nation is impacted more than Alaska, is why I'm working hard to make it better with the leadership. I'm especially working hard with Senator Murkowski and Senator Solomon to ensure as a delegation we can address a number of these Alaska-specific concerns: the high cost of care, skyrocketing premiums, lack of competition, our remoteness, and many challenges we face during our lack of infrastructure because of our lack of infrastructure and roads. We must recognize Alaska faces challenges seen nowhere else in the nation. We remain the highest cost state for health care, and therefore at times will require a different approach than the lower 48. Right now, I'm not convinced what we have is the best approach. I remain committed to repealing Obamacare, but right now we have to see if this bill is the right approach to solving the Obamacare problems. As written, I'm not convinced it does. At some point, we have to ask ourselves if full repeal is the only option. which forces everyone back at the table while Obamacare unwinds over the next 3 years. That's my position. I'm glad to answer any questions. Well, let me say, I do think that there should be a reform of Medicaid, but it has to be equitable again. I have proposed changes in our PRAP, or the percentage the federal government reimburses to the state, because it's tied directly to income. It takes no account of Alaska's high cost of living and care. If these changes can be made, and Alaska gets an equitable amount, and per capita grant would bring additional dollars to our state, and these much needed programs. But it is important to remember our cost of medicine is higher, and our distances are greater. And I say that the expansion without the equitable part of the bill won't fly. The thing that could be done, and this is some people are talking about it, would be we would have a simple repeal of Obamacare as written and the regulations as they've been applied, taking effect in year 2020. And then we, in the meantime, would take the time to really write the bill, I think, as we should. This bill is, we've only been in office 100 days or less, 60 some odd days. And we have not really taken the time. That's why this is a flex situation. I'm fighting hard to make sure Alaska gets equitable treatment across the board. And it's ironic to me that I don't see anyone on both sides of the aisle talking about the additional cost to the national debt if we go through with this program. And I still think Obamacare will break this nation. I'll rewrite in a bill that will keep this nation still solvent and have the right appropriate health care for people. And that should be our goal. This has become a political football. And it disturbs me in the sense that there isn't any real talk about why costs are high. Why are the treatments are higher because one person is insured and another person is not for the same treatment. We have to address those issues, and I don't think we're doing it in this bill. That's why it's a flexible bill, and it's constantly being added to and taken away. So I'm working hard to make sure Alaska gets, whatever bill happens, gets the same treatment. It's not different in any other state. Well, no, it all depends on the end result. If I think that we've come together, the delegation has, on fair, equitable treatment to Alaskans, I'll probably vote for the bill. But if it's not there, I'll vote against the bill because it's really not the repeal of Obamacare as we originally said we were going to do. That's why I said we'd be better off repealing it with one paragraph piece of legislation and then starting and writing the bill, taking our time to do it.